Good afternoon, everyone. Welcome to our special live program on Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. Today, we are honored to have Dr. Krishnamani, a highly expertised medical oncologist who has more than 10 plus years of experience in treating various kind of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. As you all know that May is the bladder cancer awareness month and it is a high time to raise awareness about bladder cancer. As you know, bladder cancer is reported to be 10th most common cancer among the worldwide. Through this program, Dr. Krishnamurli will share the invaluable insights on introduction to bladder cancer. So let's extend a warm welcome to Dr. Krishnamurli. Welcome,
Hello.
Doctor.
Hello and welcome. Thank you for the introduction. Welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. As you already said, this month is a bladder cancer awareness month. So our focus will be on what is bladder cancer, how do a basic introduction to bladder cancer is what we are aiming today in this session. The treatment part and all that, we can probably take it up in the next session if time permits next week. So, as you already said, bladder cancer is not a it's a 10th common cancer which we see. So it is not that it is uncommon. At the same time, it is not that it's as common as a breast or a lung cancer, but we do see a lot of patients with bladder cancer. And it is one disease in which the surgeon, the radiation, and the medical oncologist all have to work as a team to treat.
Oh,
And so during the course of our discussion, we'll have a lot of points which we are going to share of how we can prevent. Is there any screening available? What are the warning symptoms for a patient? So in that way, we'll try to spread the knowledge on bladder cancer so that people are more aware.
so thank you, Doctor. So, like, just to Doctor, let's initiate this session. But before that, Doctor, can you just brief what exactly a bladder cancer is? Generally,
So, so to put it very simple, bladder cancer in simple terms, we are talking about a urinary bladder cancer.
hmm,
Okay. So when you talk about the urinary tract, we have two kidneys and two tubes from the kidneys, which is called a ureter,
hmm,
which goes and joins into a urinary bladder.
okay.
Okay. So any the tumor which comes in a bladder or the cancer of the bladder is called a bladder cancer.
Hmm,
Okay. Usually this is in medical term, it is called a urothelial malignancy.
okay.
Okay. In medical terms, we don't use bladder cancer. We say it is a urothelial malignancy. And urothelial malignancies are commonly seen in the urinary bladder or are seen in this tubes, which is called a ureter, or the part of the kidney, which is called a renal pelvis, which
Okay.
is the central part. If this is the kidney, the central part is the pelvis. So the pelvis, ureter, and urinary bladder, all these are usually affected by urothelial cancer, which we commonly call bladder cancer. And
Okay.
in that, the commonest histology, which you see under the microscope, is called a transitional cell cancer. So
Oh,
this may be a bit too much for our lay people. If there's a medical student here, they would relate. So, but
hmm,
broadly, bladder cancer is cancer of the urinary bladder, medically known as urothelial malignancy. And the same type of cancer is also seen in the tubes leading to the bladder and also the central part of the kidney called the renal pelvis. This is what we should understand.
okay.
So a pelvis cancer or a ureter cancer also is treated similarly like a bladder cancer. Why we are talking about those two also is the treatment is like a bladder cancer.
Okay.
Yeah,
So whenever doctor there is a diagnosis of any of the cancer in these position, they will be like most commonly basketed under as a bladder cancer,
they will be treated as a bladder
or as you said, urothelial cancer, if I have pronounced it.
urothelial malignancies.
So doctor, in this bladder cancer, are there any different types available or
Yeah, so you're talking about a urothelial cancer or a non-urothelial cancer. There are some
Hmm,
varieties called squamous cell carcinoma. These are various, these are
okay,
different types or histologies. Okay, sometimes you can get a sarcoma in the urinary bladder, but they're rare. So the
okay,
commonest histology we see is a transitional cell. carcinoma.
Okay, transitional. So that is generally seen in any of these areas like we have discussed in 5 minutes back.
Correct.
So doctor, like in this also there will be any stages of bladder cancer or like that anything is positioned?
Yes. So for stages, what we do is, first of all, so as usually we discuss, right? You have to do something called a CT scan or an imaging.
Hmm.
Before that, you have to first confirm my diagnosis. Before that, I should come to you with symptoms.
Yes.
Yeah.
Oh, okay, okay. Anyhow, doctor, I guess the symptoms are also, but before the doctor, is there any primary risk associated with this bladder cancer?
So when we talk about any cancer, what is our focus? What are the risk factors, and what can we do to reduce the risk factors?
Hmm.
The singularly important risk factor for bladder cancer is cigarette smoking.
Oh,
Okay. So smokers have a high risk of bladder cancer. The
hmm.
risk persists in those people who smoke a lot,
Okay.
who have more than 20 pack years or 30 pack years of smoking. We already discussed what is a pack year. If one
Hmm.
person smokes one pack per day for 10 years, one pack into 10 years is 10 pack years. 20 years if you smoke one pack. If you smoke 3 packets per day for 20 years, 3 into 20, 60 pack
60
years.
pack. Oh my God, huh?
More, so smokers have higher risk. More you smoke, more the risk. Generally, men smoke, so men have a risk. Older the age, the risk increases of bladder cancer, and the risk persists even if you stop smoking.
Oh,
So it is one interesting cancer where, unlike in other cancers, even after stopping or cessation of smoking, the risk persists. Some small risk is still there. So the long-term effects of cigarette smoke are still there on the urinary bladder. So quit smoking. That is our fundamental mantra. Now, the other risk factors are, as I told you, age. We
hmm.
might have a more chance than women, the older age. People working in certain areas, in certain industries like plastic industry, paint industry, metal industry, welding industry, cement industry. So
Cement. Hmm.
these people, because there is a lot of chemicals released, aromatic hydrocarbons, we say, that has an impact. Passive smoking could be a small risk of bladder cancer. Other risk factors are somebody who is in a urinary catheter for a very long period. Imagine somebody has a spine problem and the bladder is not functioning. They're on a urinary tube, catheter, we call it. Those people are at risk for bladder cancer. Okay. Some medicines like phenacetin or some chemotherapy medicines called cyclophosphamide, they can cause a variety of bladder cancer.
Okay.
And diabetics have been observed in some studies to have a higher risk. Yeah. So broadly, if you have to put it singularly on few things, cigarette smoking, so no smoking, certain industrial settings where
Chemicals.
you
Hmm.
work there are a higher risk. Infections like HPV or schistosomiasis, we say. Cyclophosphamide, which is a chemotherapy drug, if given uh, in some patients, can cause bladder cancer. Chronic indwelling catheter, we call it, or chronic infections or repeated urinary infections sometimes.
Hmm.
Phenacetin, that's a drug which is not used much nowadays. That is a drug which can cause technically.
Hmm.
And it is seen in a higher proportion of diabetics. So these are all the things which we should keep in mind.
But sir, out of these all 8 conditions or the risk factors you have said, majorly it's you can say
Smoking.
that smoking.
Yes.
Smoking is the
Smoking.
main.
Yeah.
So, like doctor, if I'm not wrong, when we were discussing about the lung cancer, you just highlighted that because of tobacco, there are chances of getting more number of different type of a cancer. So even the bladder cancer will be one of them.
So we say almost 16 types of cancer can come due to tobacco smoking or cigarette smoking. Bladder cancer is one.
Oh my God. Sir, doctor, just is there any hereditary also involved in bladder cancer or it's very not
There are some
possible?
genes implicated. There's a
Hmm.
lot of research which keeps going on, but nothing as such that this is hereditary or you have to do some genetic testing
Okay.
as yet.
Okay. So no genetical or like they say hereditary history for very less we can
Correct.
say. So, doctor, like you were talking about the risk, can you just highlight or brief on signs and symptoms? What are the different signs and symptoms for bladder cancer?
Correct. So our aim is educating people here, right? So what should people be aware about bladder cancer? So what are your symptoms? So
Hmm.
you can present with painless hematuria, we say. Hematuria
Okay.
is heme is blood, urea is urine. Blood in the
Okay.
urine.
Okay.
You can have painless bleeding in the urine.
Hmm.
So any person who presents with blood in the urine, but not painful, painless, think
Hmm.
of bladder cancer. That can be in the initial voiding or throughout the urine or in the terminal passage of urine, whatever. So
Hmm.
painless hematuria or painless passing of blood in urine is an important symptom.
Hmm.
This is the commonest. If the cancer is advanced, if it spreads to the local structures, you may have a lot of pain in the area. If it spreads to brain, you may have fits,
Hmm.
headache. If it spreads to
Hmm.
bone, you may have bone pain. If it spreads to the liver, you may have jaundice or pain in the tummy. But by and large, the commonest symptom is painless hematuria.
Hmm.
Advanced cases, based on the spread to whichever organ, those symptoms you will have. You will also have urinary obstruction sometimes. You may have, what do you say, weight loss, loss of appetite, vomiting. Okay. Sometimes the growth can obstruct the kidney. So the creatinine can go up. You will have all symptoms of a kidney failure patient, like swelling of your feet, of your face, etc. That is in advanced cases. But for an ordinary person, the commonest symptom is painless hematuria. Now, what are the symptoms, diseases which can mimic this? Infection, kidney
Hmm.
stones, urinary infections. All this can mimic a urothelial malignancy.
So, in short, doctor, it is very challenging to identify whether the patient is like the patient is having some bladder cancer or not because
So
he
if you are a
can.
smoker, if you have risk factors, if you are above 40 or 50, if you have this, you don't have any history of kidney
Hmm.
stones, it's a painless bleeding. If it has
Hmm.
happened 2 or 3 times, then
Hmm.
you should not leave it like that. It's a
Yes.
warning sign. Go and seek consultation.
So, doctor, as you said, males are higher version, females are very less.
The incidence is seen more commonly in men than women.
Okay, okay.
Probably
So,
also because men smoke a lot compared to women. That's another reason why we have more patients in men.
in fact, nowadays, doctor, I have seen many of the females also having a habit of smoking, and many of
Yeah.
the times a passive smoker can also. Is it something like the passive smoker can also
Yes.
have
Passive
bladder cancer?
smoking also, studies have showed that the risk of bladder cancer is high. And as you rightly pointed out, many women, especially in the urban areas,
Yes.
uh, uh, are, what do you say, attracted towards smoking, tobacco
Hmm.
smoking in various forms, which is not a healthy practice.
Actually, smoking in any age, any gender, it's not good.
Correct.
But
This is not something where we want to be equal to somebody. So gender equality is not with related to smoking. We keep telling people. So nobody should smoke, be it men or women. So quit smoking. That's all we could tell people because it gives rise to a lot of cancers and suffering in non-cancerous conditions like heart, lung issues.
yes, very true, sir. In our lung cancer, you have already described different type of 16 cancer, how they can lead because of
Right,
smoking.
right from the digestive tract to the pulmonary tract,
Yes.
okay, to the urothelial organs, even blood cancer, anything can come with smoking. So why do you even have to take it?
True. Sir, like right now, is there any screening techniques available for blood cancer with related to this?
So as we always emphasize, screening is a test which is done in a general population to identify disease early.
Hmm. Yes.
Okay, for screening to be done, the test should be simple, it
Hmm.
should be reliable, it should be reproducible. It should
Hmm.
be means you can everywhere in the world you should be able to reproduce the test and the validity. It should be cheap. It should be applicable to the local population. The local people should also be okay getting the test, and you cannot get a some completely sophisticated test to a village and say I'm going to do this. And nobody is going to take it.
Yes. Hmm.
So bladder cancer, ideally, if you ask me, there is no screening test.
So
Yeah.
it might be
So for
network.
bladder cancer, ideally there is no screening test. like a breast cancer or a cervical cancer. People have tried to look at high risk groups. So, in general, if you
Mm.
are a chronic smoker, you have more than 20, 30 pack years of smoking, okay, uh, and you have done a urine cytology, basic urine test, and you
Mm.
find few RBCs, we say red blood cells in the urine, more than 10 or 20, then they say, okay, this fellow is maybe high risk, screen this person with a uh, urine cytology or maybe a cystoscopy, etc.
Okay.
But by and large,
Mm.
screening is not there for bladder cancer. It's not a recommended method.
Okay.
Some expert groups or some clinicians a few times may say, see, you are old, you have had a strong history of smoking, you're having some vague symptoms, RBCs are being seen in your, though you don't have blood in the urine to be seen, but there is blood, red blood cells which are seen in your urine. That means you're having blood loss, which is not visible. So let us get a test done. So that is screening.
Okay.
Otherwise, most of our action is actually a reaction to the action. So we are only reacting when somebody gets symptoms. So any painless hematuria, if somebody comes to us, we are going to react to that, saying that, okay, you may have bladder cancer or infection or stone. We will start evaluating.
So, in short, doctor, any symptoms, it is like basic symptoms which we can identify the bladder cancer.
Very simple. You have hematuria, go to your doctor. Blood in the urine, meet your doctor. If he
So,
says stone, well and good. If he says infection, well and good. If it is not cancer, excellent. Rule it out.
yes.
If it
So,
is cancer, you are picking it up early also.
in fact, picking it up early can be easy for a patient to get cured also.
Yes, higher the earlier the stage, higher the chances of cure.
Sir, there is a query from the audience. It is from World 2024. He is claiming that is bladder cancer permanent?
See, no cancer is going to be permanent if it is cured. So we are discussing whether we can cure this. So you find it
Hmm.
at an early stage, you treat appropriately. The disease doesn't recur, you are cured. So why is it permanent? It is not going to be permanent. In the unfortunate setting, it is metastatic or stage 4. Then you're not talking about cure. Then you are thinking of extending the lifespan of a patient, reducing the disease, etc.
So, doctor, like you were discussing about the screening techniques, is there any specific test? Yeah, right. Anyhow, you have told that there's a basics test by looking into the urine and screening. So, these are the only tests which is available, which play like diagnosis of the bladder cancer.
For diagnosing, what you do is when somebody comes with these symptoms, you say first get a urine cytology done.
Hmm.
You look at red blood cells. It's a simple test. You give the urine and see. You look for red blood cells in the urine.
Hmm.
We look for cancer type cells called malignant cytology in the urine only.
Okay.
And then the best test is always a cystoscopy. Like an endoscopy is a camera or a tube which has a camera at the end which goes through your stomach or the
Hmm.
foot. Cystoscopy is a, to simple words, a tube which has a small camera and that goes into a urinary bladder. With that, you are able to
Okay.
see what is there in the urinary bladder. Is there an ulcer? Is there a growth? Also,
Okay.
if something is there, you are going to do a biopsy also. So it serves two purposes. One, visualize, see what's going on. Two,
Hmm.
take a tumor part and come out for
Okay.
biopsy. So it gives you diagnosis also.
Hmm.
Sometimes you can even do a resection, removal of the tumor. That itself is your treatment also.
Yes.
So for bladder cancer to be diagnosed, we need a cystoscopy and a biopsy.
Hmm.
The next question is, if it turns out as cancer, the question is, what is my stage? For stage, you will do a CT scan of the abdomen pelvis,
Hmm.
whether it is in the bladder only, whether it has gone to nearby lymph nodes, it has spread to distant organs. So basic urine cytology, cystoscopy biopsy, CT scan. This is how you are going to diagnose bladder cancer.
So, sir, in short, basic bladder cancer, the urine test plays a major role, if I'm not wrong.
Urine test is a first test. Cystoscopy plays a big role. And your CT scan is for your staging.
Staging. So, confirmation, three steps.
Three,
Urine
basic,
test.
middle, and final.
Okay. So, the middle one will confirm whether the patient, because of the biopsy, it will confirm the
Whether cancer
cancer.
is there or not.
Okay. Okay. So, this was something, I guess, doctor, the bladder cancer is quite exciting and it has a very deep things to learn also. because everybody are like, okay, they are only aware of breast cancer, cervical cancer, or lung cancer, which is highly known among the people. And whenever there is a lung cancer, tobacco plays a role, that don't quit smoking, quit smoking. But I guess for bladder cancer also, we should create something like that of quit
Correct.
smoking. And
Correct. So we should quit smoking. Painless hematuria is the symptom.
hmm.
Cytology is a first test. Cystoscopy is the test with which you diagnose, and staging is with CT scan.
So there is one more query from Suman telling that, can we avoid bladder cancer?
Don't smoke, the best way you can avoid.
Hmm.
Okay, rest of the factors are all not in our hands. Yes, occupational exposure can be minimized.
Uh-huh.
Keep your sugars under control, have a healthy lifestyle, drink lots of fluids. Some research has also shown that those people who take a lot of water or fluids a day have lesser risk of bladder cancer. So basically, healthy lifestyle, no smoking.
Sir, the same Suman is asking that drinking lots of water can reduce the risk of bladder
So
cancer.
yes, it's actually there. So I was reading up a few articles just before even preparing for today's session. So there are some studies where people have done where they've seen that those people who drink lots of water,
Uh,
okay, have a relatively lower risk. Yeah.
okay.
And the theory which they have given is when you drink lots of water, you are washing out all the harmful chemicals or carcinogens.
Yes. Yes.
So
Huh.
the bladder mucosa, the bladder layer is less exposed to harmful chemicals.
Okay.
This is a theory. Yeah, but see, drinking water is not, you're not going to drink 10 liters of water a day. We always ask people to drink at least 3.5 liters. 3 liters of water is a must, especially in hot climates or in the April, May, June, summer months of India. So drink lots of water, take lots of fluids. It will always help you.
Drinking water doesn't harm, no, doctor. But
Fruits,
doctor,
fruits.
I heard, might be it's a myth, I guess, if I'm not wrong. Somebody say that if you drink too much of water, no, your urinary system will be tired. Like that, I heard somewhere.
How much are you going to drink? Are you going to drink 20 liters of water a day? No.
Not possible.
Mhm. So you hardly go. The urinary system, God has created it very well. It can take care of itself.
So hardly, at least it's a message that 4 liters a day will,
Yeah, 3 liters or 4 liters. Yeah.
it's good to go. So doctor, this was something very exciting. I guess much more exciting sessions are awaiting in the coming weeks. So by this we have came to an end, doctor.
Yeah, the next
Thank
session, hopefully, we will talk about
you.
staging, which you said. How do you
Yes,
stage? So if I have to just complete that, we have some time, I think 2, 3 minutes.
yes.
So in bladder cancer, right, the CT scan will give you the stage. More importantly, the staging is in the bladder, there is the muscle inside the bladder.
Yes.
Okay, so we call if the tumor is going through the muscle, which is
Hmm.
muscle invasive or away from the muscle called non-muscle invasive.
Okay.
So when you do a bladder biopsy, when the report comes, it says muscle is involved or it says muscle is not involved.
Hmm.
Muscle is not involved means it's early stage. It is better.
Yes.
Muscle is involved means it is slightly higher stage.
Okay.
It is still in the bladder only. It has not
Hmm.
spread anywhere. See, spread outside is stage 4. Within the
Yes.
bladder, non-muscle invasive is better. Muscle invasive means the stage is slightly higher.
Okay.
So for non-muscle invasive, the treatment is different. For muscle invasive, the treatment is different.
Okay.
So as a doctor, when I receive a biopsy, I should look whether the muscle is involved or not on on the biopsy specimen, on the report.
Hmm.
If it is not mentioned, I should go back to my pathologist and ask him or her saying that is the muscle involved?
Oh, to be
So this is a
more
very,
clear.
very important thing.
Hmm.
This is a very important.
Yes. So whenever there is a this kind of a test, if the patient is going, he should be very clearly known that whether the muscle is involved or not
Hold
involved. So
on.
it will give a better picture for a doctor to proceed with
That
the
will
treatment.
decide your future treatment,
In short, that is the main point for the treatment decision making.
which obviously we are going to discuss next week.
Doctor, by saying these 3 4 lines, now you have created a curiosity of what will be exact treatment. So curiously we'll be waiting for the next week when
Right.
it will be. So you have just created a curiosity among everybody, I hope. So it's something very excited. Thank you very much, doctor, for your valuable time. Doctor, as per today, for just a brief about the bladder cancer, would you like to give some closing statement?
Yeah. So it is neither very common nor it is uncommon.
Hmm.
As you said, 10th most common cancer, which we see, number one. Cigarette smoking is primary risk factor, so quit smoking. The main symptom is painless bleeding in the urine.
Hmm.
If it spreads to other organs, you can have pain while passing urine or pelvic pain or other kinds of symptoms. The first test is a urine cytology. But diagnosis is by a cystoscopy and a biopsy.
Hmm.
And spread is known by a CT scan. And on a biopsy, always check has the pathologist mentioned, is it muscle invasive or not?
Yes.
That is the uh, introduction for bladder cancer for today.
In fact, sir, these 5 points right now, which you have mentioned about the test to diagnosis to CT scan, and also the invasive and non-muzzle invasive, I guess this will really help a common person to analyze before, like after going to a doctor, and also it will help them to create a clear picture that what will be their future for the treatment, doctor.
Yeah,
So hopefully, doctor, the more clarity on the treatment and in-depth knowledge about the stages will be discussed in the coming week, as doctor you have promised it.
we'll do it
So
next week.
yeah, so I hope all our audience will be eagerly waiting for that. So thank you very much, doctor. Thanks a lot. And thank you everybody for having patiently go hearing this session. So let's meet our next session in the continuation of the bladder cancer. So till that, wishing you all strength, happy, good health from Cancer Reach.
Thank you.
Thank you.